When I woke up, February 18th, 2015, and I thought, I'm in trouble. I couldn't breathe right, and my chest felt tight.
They found an aneurysm, and I was informed that that type of diagnosis is also called a widowmaker, because if it were to burst, you only have minutes to live.
Went out to work out one night with a friend of mine. Felt great. Was actually doing a plank. All of a sudden, I felt something kind of go off in my head, and I knew something was wrong.
Back in the early 1980s, when we were looking at various programs and services that we believed we had the capability and that we thought were very, very important to providing services to our community, Dr. Brown, who at the time was our Director of Cardiorespiratory Services, came forward with a vision of becoming a comprehensive cardiac center.
When I came to Pomona Valley, we had a very good hospital. We had excellent internists and surgeons, but we weren't a specialty hospital. And we had lots of people that had heart attacks, and we would work very hard to keep them alive, but the level of care at that time was more supportive than interventional. We were very lucky in having an excellent physician, Dr. Thumati, a cardiologist, come into our community shortly after I was there. And we could see that Dr. Thumati could do the procedures that needed to be done, but we didn't have the equipment for him to do it at our hospital, so the patients would have to go to Los Angeles. It was that kind of effort that he did that led us to feel that we in our community should have a more advanced heart center than we had.
So Dr. Brown and Dr. Thumati and Dr. Valetti were basically the leaders and the whole champions of this program. That was very important to this community.
When I arrived in 2000, we primarily focused on heart. And we began in the early 2000s a discussion about peripheral vascular disease and looking at the entire vascular tree of the patient.
It was a natural for our program to advance from the cardiac services to the cardio and vascular services. So the STED Heart program has evolved, and obviously the name changed to recognize the evolution that we've expanded not only from a cardiac point of view, but in a vascular way.
In the midst of all of that, we expanded the vascular component to the brain. And with Dr. Thumati's work with carotid artery disease and so forth, it was a logical transition for us to go and expand our program into managing brain and stroke.
A lot of the same risk factors that cause heart disease can cause stroke. So it just makes good medical sense. If you have an active heart program, that your stroke program has to be well developed alongside of it to be able to potentially take care of those problems that might occur in that same set of patients.
We began that journey in 2010 with the advent of becoming a primary stroke center, treating the vascular tree of the brain. And we've been on a roll since 2010. We haven't stopped 1 second, becoming a comprehensive stroke center in 2018. And every accomplishment, every patient we've taken care of has resulted in more knowledge, more technology, more training for our staff, to the point now where we have a dedicated neuro unit. We have dedicated and trained neuro nurses. We are a leading comprehensive stroke center on the eastern edge of Los Angeles County and on the western edge of San Bernardino County. And the sky's the limit.
When they came and they were taking me out, I said, well, I go to San Dimas Hospital. And the pharmacist said, no, 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 no. You're going to Pomona. There is no hospital better than Pomona for what you have. My right artery was completely blocked, and my heart stopped before they got me into surgery. And they really did not think I was going to make it. So thankfully, I was taken to Pomona Valley Hospital, where they obviously have the best doctors.
When I woke up in ICU, they told me that I had had a stroke, and then I was really scared. I went from one day going to work out to like 2 or 3 days later, I couldn't even barely walk down the hall. It was extremely humbling. But the care that I received in the ICU during that time was, honestly, they were so kind and so empathetic and so positive. That stroke unit is phenomenal.
Our philosophy here at Pomona Valley is patient and family-centered care, always putting the patient and their family needs at the forefront.
And it isn't just patient-centered at the time of the event, but also the continuation of that care throughout their lifetime. We provide services and resources to patients and their families to help support them on that road to good health. We have a world-renowned, recognized cardiac rehab program that really doesn't exist in other areas throughout LA County.
Patients feel safe and comfortable to come here. Yes, they can go to a gym. Yes, they can continue to do their own workouts. But it's amazing what a monitor does to some of these patients, because anything that they feel, they start thinking, oh my God, I'm having a heart attack or something's going on again. So when they come and they see that their heart's doing well, it just becomes this process, not only mentally and physically for them, but they just start getting better. They'll be here anywhere from 12 to 36 visits. And when they complete it, they just feel a sense of accomplishment.
We have cardiac support groups. We have heart failure support groups. We have a stroke support group. And all of those entities provide additional support to the patient and family. The dedication at the bedside of the staff that's trained. Our nurses go through additional 8 hours of training for the care of the stroke patient that doesn't occur across other hospitals in the area. Our staff in the cardiovascular intensive care unit is expert in the care and the management of those patients. That level of commitment and that dedication is on the individual nurse and practitioner that see it as their mission to carry out the vision of our cardiovascular program. That same vision that Dr. Thumati and Dr. Brown and our team of cardiologists that got together way back in the early 80s. I mean, that's what we're here for.
As we see more of our community aging, we're going to see more people needing the facility of cardiac services. And so it's really important that we not only maintain what we have, but also we continue to grow and continue to implement all the different new technology that becomes available. And in order to do that, each one of us needs to look at our own hearts and see how we can give in order to be able to provide for the continuation of this wonderful program.
Philanthropy established the foundation for the program. And the Stead family has been instrumental in that. And they've been instrumental throughout the growth of our entire program.
It has been a real pleasure. And I'm fortunate that I was in a position that I could help them. And I'm proud to be able to say that I was able to provide a little assistance.
Our job as physicians here is to be here and serve our community. And we want to serve our community to the best capability that we can. And I think we're doing that. From the cardiovascular program to the stroke program now, we're providing services to our community that are second to none. We are offering the most standard of care and advanced practices in both neurology and cardiovascular medicine. But obviously the community itself is instrumental in helping to develop the hospital as well. So we definitely need the support of the community to continue to advance our programs and to have the latest technologies in order to serve the community as best we can.
People want to invest in the infrastructure of the community, I might say. People want to support the kind of care that they see being given. And our hospital is committed to its community. So many people don't have insurance, and yet our hospital is one of the few that take care of everybody, no matter what their financial ability is. I'm proud of that. You know, that's the kind of hospital I want to be associated with.
I came to this hospital in 1981. I lived this place more than any other place in my life. So this is my community. I met wonderful people. My colleagues are good. My nursing staff is good. I don't think I could ask better than that. Better community, better colleagues, better associates than what I had. I always thank God for what He has given to me.
Dr. Thumati has been, without a doubt, the best physician I have ever seen. He cares about his patients. He cares about the heart center. He's always trying to have us do better. Those are the elements that make a great center.
Dr. Thumati, he is a pioneer in developing our heart center. He was the first interventional cardiologist, and he had a vision that we can treat this heart victim locally rather than have to go down to downtown Los Angeles.
He's a teacher, a mentor, a visionary, a kind man, an excellent doctor. I just can't say enough wonderful things about Dr. Thumati and the impact he's had on our hospital, our patients, our families, and myself.
Really a tremendous human being. Everybody, including myself and my family, love Dr. Thumati. He's been a dear friend for over 40 years and a colleague in terms of what he has done and brought to this institution. He represents what I think this institution represents, and that is, if you can't do it well, you don't do it. And that's what made this program to be where it is today.
Everybody associates the cardiac program at Pomona Hospital with Dr. Thumati, and I think that's a fully deserved reputation. I don't think we'd be where we are today without his efforts.
We certainly appreciate all the time and commitment that Dr. Thumati has dedicated to this center. As he retires, we are definitely going to be missing him. But the impact of his career in our hospital, in our cardiac center, is going to be felt here for generations to come. He has built a foundation which really is going to carry us not just through this transition as he leaves us, but really for many, many years to come.
I told my staff it is a natural process. We have to know our role, we have to know when to leave and how to leave it. So I felt this is my time to leave. There are good people out there to take over. I thought it's my time to step down. I did the best I can. Nothing there for me to feel or regret what I did. I stepped down with a happy and very satisfied consciousness.
One of the legacies that Dr. Thumati is going to be very proud of is that the people that he has recruited and mentored over the many years to develop this program are now to take over the reins for the next 40 years. And I am very proud of what he's done, and I'm certainly sure he's very proud of what he's accomplished.
All of the preparation that we've done over the course of the last 30 plus years has led to this point, and the preparation for us to continue the legacy by preparing those that are in the path to assume the responsibility to catch the baton, to bring it on to the next generation.
My role is to continue to keep those efforts going. It's obviously metaphorically huge shoes to fill, but he will continue to serve as my mentor, and I'll continue to seek guidance in terms of what we need to be doing. And of course, I'll continue to look to others around me for support, and my intention is to continue to keep the program going so that we can continue to offer cutting-edge treatments and new services to the community.
Dr. Thumati is leaving the center in excellent hands, not only under the leadership of Dr. Reddy, but everyone else that works in the program that will be here to carry on the mission.
I celebrate our heart center. I lived my life to try to keep from having heart disease, but I'm confident that if I had it, this is the place I'd want to go, and the people who are here are the people that I would want to take care of me.
Thanks to Pomona Valley Hospital, I have the quality of life today that I don't think I would have had if I had not gone there. I owe my life to them.
This is where my family, where I will be treated, have been treated, so it's important to all of us.
I have to be doing something at all times, and I can do that because of the treatment and the care I've received at Pomona Valley. They have afforded me the luxury of not being in bed, not being down. My hat's off to Pomona Valley.
I'm so grateful to everyone at the hospital. I'm so grateful to everyone in ICU, all the nurses, all the doctors. I wouldn't be sitting here feeling the way I do without them. Each one of them has contributed to my recovery, and I don't have the words to thank them for that.
Tonight, we're celebrating and recognizing 33 years of the Stead Heart and Vascular Center. Looking back on that and the growth and the development and the evolution of it, which we're also very, very proud of. Tonight, this is a special night in that we are here to recognize Dr. Thumati. His leadership, his devotion, his humanity will leave a legacy forever. It's not only the legacy of a program, but it's the legacy of the people who made this program what it is today. And I think their legacy is even more powerful when we look towards the future, because they have laid the foundation for an incredible group of people that we see as being the leadership and the future of this program. We should all be incredibly pleased and proud of what they have accomplished and where we see the future of this program going.